Hello, everybody, and welcome to the Tuesday edition of Video Clips. Just a couple of things I'll mention. The mini professional development course begins this Thursday, just 2 days from now. 3-class series covering everything from research basics to how to start, develop, and maintain an independent practice will be covered. The course is $249, which you can then turn around and apply to any of our offerings, professional development offerings, if you choose. That's the first thing. Second thing, Optimal Life and Health with Pam Part 2 this weekend. Only time it's going to be offered this year. You wait till next fall. 2 spots left. So if you want to join, this is the time to do it. Send me an email at pampopper@msn.com. Last thing, cookies. We're shipping them now. Christmas cookies, holiday cookies. We can ship them any place in the United States. Shipping included, $24.95 per dozen. So if you want to order cookies, don't tell me. Call the office, 614-841-7700. Now, I have really interesting information to share with you about cancer today. So a couple of months, this whole story starts where a couple of months ago in our advanced study class, which is a monthly class series where we study important books on health, we studied an older book called Beyond the Magic Bullet, and it was about the use of combination therapies for treating cancer and included reviews of several commonly prescribed drugs that offer benefit when repurposed, used off-label as adjuvants for the treatment of cancer. And these included a whole repertoire of drugs like antibiotics, blood pressure meds, anti-inflammatory drugs, etc. So I read with interest a new study showing that inexpensive over-the-counter antihistamines show promise as adjuvants in the treatment of some cancers. Now, let's just start with some basics here. Histamine is a hormone that increases in response to injury and in allergic and inflammatory conditions. Histamine levels also increase when humans are dehydrated. And then some of the symptoms that you're familiar with that involve high histamine levels include nasal congestion, hives, fatigue, and headaches or migraines. Well, according to new research, high levels of histamine and one of its receptors are associated with resistance to immunotherapy drugs called immune checkpoint inhibitors, which are used in the treatment of cancer. Now, immunotherapy is designed to empower the body's immune system to fight cancer. There are several mechanisms of action, including the stimulation of T cells to identify and kill cancer cells. The therapy doesn't work in all patients and sometimes only works for a short time because tumor cells become resistant to T cell attack. And that's one of the things about cancer cells. They're not necessarily stronger than normal cells, but they're very clever and they mutate. Well, anyway, in this new study, patients who were taking antihistamines responded better to immune checkpoint inhibitor therapy than those not taking these drugs. The researchers reported that allergic reactions, which is stated before, result in higher histamine levels, suppress immune function, specifically T cell function, important in this case. High histamine levels also promote tumor growth and promote resistance to immunotherapy. They also reported that higher histamine levels were correlated with poor response to immunotherapy treatment. Cancer patients with low plasma histamine levels had an over 3 times greater response rate to anti-PD-1 treatment as compared to patients with higher levels of plasma histamine levels. This difference, of course, translated into significant improvement in survival time for the patients who had low histamine levels. The researchers concluded that there's strong evidence to support the use of antihistamine drugs to immunotherapy treatment for cancer patients as an adjuvant. And of course, they state that more research is needed in this area, and I agree, and I'm all for that. But I'm going to mention a couple of things that are important for those of you who are watching this right now. First, I can't tell you the number of times, it has to be hundreds, where people have been sitting in my office or talking to me on the telephone about their health issues and have made the claim that until this major health event, cancer, heart attack, whatever, they were just fine. And often that's not true. The issue is more that what seem like incidental issues, oh, I have allergies, oh, I have headaches, oh, I have irregular menstrual periods, whatever. People just tend to let those things go by. And on the one hand, I don't like to see people turn into hypochondriacs because the health profession does a pretty good job of making people frantic about all the wrong things. And I think people hang out with doctors too much. But the other side of it is a series of these seemingly minor things add up to a lot. You can resolve allergies. I mean, an immune system that's misbehaving is not good for future health. And so, and I'm not talking about taking antihistamines to suppress the histamine response. I'm talking about getting to the root of why you're having these allergic responses and doing something to address the cause. Part of that is drinking water. There are a lot of consequences of dehydration, not just higher histamine levels and allergic responses, but increased risk of heart attack as your plasma, which is 60% water, becomes, shrinks down and becomes thick and sticky and viscous as a result of dehydration. So drinking more water is a pretty easy thing to do and makes a huge difference in your health. So pay attention to what's going on. Your goal is to be as healthy as you're capable of being, and that changes based on different backgrounds and medical histories and ages and all that sort of thing. But seek help. People have forgotten how to do that. Maybe never really had to in the past, but in today's society, you have to deliberately seek help. That's why people participate in these optimal health and life with PAM weekends. Now, just a big problem, in reference to combination therapies and off-label use of drugs for cancer. One is that oncologists are remarkably resistant to doing this type of thing. They don't like to prescribe off-label drugs, and they often don't like for patients to do anything different or in addition to what they prescribe. The good news in this case is that antihistamines are available over the counter, so no prescriptions are required. So that makes the use of these drugs relatively easy to do, but we definitely need to change the regulatory landscape so that it's easier for cancer patients to use off-label drugs that have promise and shown promise in terms of being used as adjuvants for cancer treatment. So I hope that you found that interesting. High histamine levels, lots of things can cause that, but allergies are a histamine response. Dehydration causes a histamine response. Those are things you could do something about and would most likely contribute to a reduced risk of cancer. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy learning from me, and I'll be back to you tomorrow with more news.